might make a start. Before we do, though, I would just like to acknowledge Aboriginal and Torres Strait Islander peoples as the first Australians and traditional custodians of the lands that we're all joining this meeting from today. I am joining from the unceded lands of the Awabakal people. I would also like to pay my respects to elders past and present and extend that respect to any Aboriginal or Torres Strait Islander people who might be joining us. Welcome so much to our webinar this morning. I'm super excited for this session, which will be taking a look at technology and automation tools that are around to assist in producing high quality systematic reviews. I'm sure many of you have, like me, have direct experience of the immense amount of work involved in producing high quality systematic reviews. So I'm very much looking forward to hearing about what's out there to help ease some of that burden. So I'm very pleased to introduce our presenter, Dr. Rebecca Hodder, who is a Research Associate with Cochrane Public Health, an NHMRC Research Fellow and one of our research leads here with the National Centre. Rebecca will be drawing on her extensive hands-on experience and expertise in systematic review methodology and automation to guide us through this topic. So before I hand over to Rebecca, I just wanted to let you know that Rebecca will be presenting, and then we've allocated time for Q&A later in the session. We'll also be monitoring the chat, so if you want to put any questions there as they come to you during the presentation, we'll take a look at those. But otherwise, as I said, we'll open up the floor for questions after Rebecca's finished her presentation. So that's all from me. Thanks again for joining us, and over to you, Rebecca, whenever you're ready.
Wonderful. Thanks so much, Meg, for the introduction. Hopefully you can see my slides. Excellent. Wonderful. So I'm delighted to be presenting this webinar today on automation and technology-enabled tools that you can use for the conduct of systematic reviews. Before I begin, I'd like to also acknowledge the traditional custodians of the land that I'm presenting from today in Newcastle, and that's the Awabakal people. I'd like to pay my respects to elders past, present and emerging, and extend those respects to any Aboriginal and Torres Strait Islander people that are joining the webinar today. Okay, so before I get started, I wanted to start with some disclaimers and some caveats on today's webinar. So first, what I am not going to cover. So I am not going to talk about why systematic reviews are important. I think everyone knows they're considered the highest level of evidence, and probably many of us have had experience with conducting them and know how much kind of work's involved in the back end. I'm not going to talk about how to conduct a systematic review. There's many handbooks, there's guides, there's many webinars out there, including some more that we'll be presenting as part of this series that you can draw on. I'm also not going to talk about how much funding, how much people time is required to do a systematic review or how long they can take, except to say that it's considerable on all fronts, and that's why innovation to reduce the resource and is required to improve the efficiency and why it's so important. And I'm also definitely not going to talk about the technicalities of how machine learning and artificial intelligence works and the differences between supervised and unsupervised AI. There is incredibly smart people that can explain that in detail and much better than I can. So for this webinar, what I'll be doing today is broadly describing the tools that I, across the review steps, that are either machine assisted, so they combine human and machine effort, which are usually known as active learning tools, versus those tools that are entirely automated and require actually no human interaction. So the aim of the webinar is to provide an overview of the exciting advances that we've seen in automation and technology-enabled tools, partly catapulted by the explosion of AI, that are really there to decrease the resources required and increase the efficiency of the reviews. 40 minutes is what we're aiming for the webinar. It's definitely too brief to list every tool that's around there or do a deep dive on how to use each of these tools. So instead, I'll be focusing on describing the broad range of tools with a focus on those that are free, readily available, have been evaluated to some degree, with a bit more of a deeper dive on how some of them are used and some of the tips for getting the best out of them. And one last note before we get into an overview, the information that I'm presenting today is adapted and series of recent systematic reviews, and at the end of the webinar there's all the reviews And it's also experience testing within our research group and with my other amazing colleagues, which I'll acknowledge as well. So, an overview. So, what the webinar is going to be broken down into is the stages of the review, where I'll look at which kind of tools are available for which of the steps. Then we'll look at some of the systematic review systems that are out there at the very end, and then look at some, go through some kind of take-home messages as well. But you can see there the protocol search strategy, implementing the search, record management, title abstract screening, full text screening, extracting data, risk of bias, analysis, and data visualization all have tools out there that you can use. Okay, so hitting the first one, protocol and search strategy development. So you've decided to take on a systematic review, you've got a general idea of your research question. There are a number of tools out there research question, as well as your eligibility, which you would organise against the PICO statement, so your participants, intervention, comparator and outcome. So there are some fully automated tools like Swift, you can see first up in the table on the screen, in which you can add those PICO criteria, so your participants, intervention, outcome, comparator, into this tool, and it uses AI to extract information from studies, identify research, and then summarize your eligibility criteria so that you can get a general sense of what studies may. So the other types of tools, and I should say for each of these steps, I'll be showing a similar kind of table up on the screen. So you'll see the names of the tools down the left-hand side, whether they are actually free or not, whether they've been evaluated to some degree, but also the links for how you can actually access each of them. So the other type of tool that you can use for developing your search strategy and protocol is for when you've got a review of randomized controlled trials. And so what some other tools actually do is database that sits within them of confirmed randomized controlled trials that you can search within. And so Trial Streamer, which is the second tool up on the in the table, is a living and annotated database of about 900 randomized controlled trials. And so based on your search, it'll summary of the studies that are likely to meet your eligibility and some kind of brief about also what their key findings, sample size, etc., and an indicator of the risk of bias. What these sorts of tools are limited by, what's in those databases, and so we know that there's, well, a lot more than 900,000 randomized control trials being conducted to date, and so some of these tools aren't currently exhaustive. So some of the other types of tools you can see in the bottom half of the table are semi-automated tools, and that's like the Systematic Review Accelerator suite of tools that's been developed by the Bond University. And so you can use these for all types of reviews to develop your methods and your protocol, develop your search strategy and refine it and adapt it for use across databases, which we'll just take a quick look at on some of the next slides. So the first one I'll describe is the Systematic Review Accelerator, or SRA, Methods Wizard. So this is a semi-automated tool to guide the write-up of your methods section of a systematic review protocol, but can also be used for actually drafting your manuscript at the other end as well. It's really easy to use. Essentially what you need to do is the tool, open up each sections of the methods within it and complete a series of prompts. The tool then generates sentences that you can then save directly into your manuscript, and there's also the option at the top where you can develop an entire research plan and export it into Excel. So you can see, I know that some of these images are going to be a little bit dodgy, but you can see on the bottom right hand side an example of answering the prompts for risk of bias and how it was conducted, and that bottom square at the bottom that's highlighted is the sentence that it generates for the methods for how risk of bias was conducted. Slowing down. And so the other tools that I wanted to highlight in this section as well, there's 3 other tools built by the researchers at Bond University that are intended to be used together, and they're really to develop and refine your search strategy. So you can see those 3 listed there. So there's a word frequency analyzer, which assists with the design of search strings to find relevant literature to answer your systematic review question. There's the search refinery, which strategy so that it's maximally efficient and only finding the literature that you want, that you're after. And there's also the polyglot search translation. So it automatically, rather than manually, translates the search string or the search strategy from one database into others, which might have their own syntaxes. And I'll just show those briefly on these next slides as well. So you can see on the screen now, just a screenshot of the SRA word frequency analyzer. So to use this tool, what you actually need is a set of articles that you know you want to include in your review that are also indexed in PubMed. So what the tool will do is generate output to show how many times each word appears in the title, abstract, and keywords of those studies. The idea being that you would select those search terms or those terms that are most frequently used in your search strategy. And you can see on the screen, this is an example just from 3 papers from our Living Systematic Review of Fruit and Veg interventions in children. And those studies, or those kind of terms, sorry, in the top section, with the highest points appear in the most papers. So they would be the terms that you would prioritise for your search strategy. So the second is the search refinery. And so in this, for this tool, what you would do is paste strategy that you generated in the previous tool within the word frequency analyzer, and as well as the PubMed IDs from your seed articles. So those 3 PDFs that you might have that were eligible, that you think that would be included in your review. And what the tool will do is generate the number of citations that the search would generate, and also a visualization of those results by keyword clusters. And the reason that you want to do this is you can then look to see across that kind of tree or kind of clusters of words where the search is actually producing no results, and you might want to remove some of those search terms or edit or amend any of them to improve your search results. And the final tool in this suite is the Polyglot Search Translator. So this is a tool that is particularly useful for translating search strategies from one database into another database. So for example, it would translate a search strategy that you've developed in PubMed or Medline, which you can see on the left-hand side, into the correct syntax for a number of other databases. On the screen, you can see there's Cochrane and Embase examples out to the right-hand side, but there's many in there that you can select from to translate. Just a quick note on this tool though, it cannot check for subject terms. So there is still some manual kind of work involved in using this tool. So the next tools are around supporting the actual implementation of your search. And there are a number of tools that you can see listed up on the screen, many of which are free and some have been evaluated. So tools Swift Active Streamer, Nested Knowledge, and Epi Reviewer all have the capacity to conduct automatic searches within their own system, and that actually includes not just an initial search, but also automatically importing new published references over time. So this type of tool is particularly useful for living systematic reviews where you're doing frequent searches. However, some limitations which we'll just compare each of these on the next screen. So this is probably quite a lot of information on there, but basically what you can see is the 4 tools that can do automated screening that I showed on the previous slide. And what we've done is applied these to our recent review that we did of school implementation strategies, which to date, a lot of our searches we've actually done very, very manually, but we're just in the process of converting it to a living systematic review. So we're looking for all automation tools that we possibly can. So on the right-hand column, where we have manually done all of our searches. And then you can see in the middle, Distiller and Swift Active Screener can search a number of our databases automatically. So Distiller covers the most. There's Sonal, Embase, Medline, and Psyche. Active Screener will do some of those as well. And we could use the Nested Knowledge tool for any automated clinical trial registries in the future as part of this review. So Epi Reviewer is listed in here and it's in development. I'll talk about a bit more about that in some of the other slides as well, but it'll have similar functionality to these other tools in the future. And the other thing I guess to note across all of these tools is that they all support PubMed. However, you can see for this example, for our review, PubMed's actually not part of the databases that we search, but that's just something to flag as well. So the other option that we actually have within most of the databases that are used for systematic review searches is setting up auto alerts within each of your databases. So these can either run your search automatically and send you a file of citation export into your screening software, whether that so request, or you can set it up where it's actually sent to you each time new studies are found, which is more like central, and Google Scholar has that functionality. There's some tips and tricks, I guess, from our team in terms of using these auto alerts, which we are using for a range of our living systematic reviews at the moment, which we've got some advice from our amazing research librarian, Debbie Booth. So you've just got to make sure that you are logged in before you set up these alerts. You enter your search strategy the same way as you normally would for conducting a search in Medline, and then you can save your search and schedule auto alerts, which you can kind of see on the screen there. But it's a very, very, very simple process to have these records delivered straight to your inbox in a file ready that you can upload straight into EndNote. So it certainly saves you some time. So there's also a series of automation tools that can enhance your search by doing both forward and backward citation searches. So this is a step that more and more we are, seeing within systematic reviews, and it's recommended for conducting within systematic reviews to identify not just potentially other eligible studies, but also any of the important papers that might be associated with the studies that you already have included in your systematic review. So you can see three there on the left-hand side: Citation Chaser, the SRA, Spider Site, and also Web of Science. And then on the next screen, I'm just going to quickly compare these so you can see what the differences are between them. So on the screen, you should be able to see the three tools. So Web of Science, you can see what they do. You can see whether they do forward citation searching. You can see that Web of Science does auto alerts for forward citation searching, whether they do backward citation searching, which they all do, what sort of formats these tools download into, whether they download an abstract, if there's any deduplication that's embedded. So what we wanted to do for the purpose of this webinar is actually test it against our school's implementation strategy review. So on the very right-hand column, you can see that we had 38 studies that were included in that review. When we used each of these tools, we saw, very good recall kind of location of 37 of 38 studies for both Web of Science and the Citation Chaser, slightly less for the Spider Site. But you can see across most of the categories that Citation Chaser picked up actually most of the studies, so looking at both the forward and backward, with the exception of the backward citation, which Web of Science picked up the most. But I think from our experience, like with Web of Science performing so similarly compared to the other studies, it has the added benefit of also setting auto alerts. So that's the one that we tend to use within our reviews. So another important aspect to implementing your search is deduplicating your records, which, maybe not a very exciting step of a systematic review, but certainly an expected step and an important step to reduce the amount of records that require screening within your author team. So there are a number of tools out there that automatically find duplicates and remove them. Probably people are quite familiar with some of these. So that's EndNote and Covidence, and they are very easy to use. In our experience across our reviews, generally what we've found is Covidence will find more duplicates than EndNotes. And then some of the other tools like the SRA deduplicator and EPI reviewer in the bottom half of the table require more of a manual checking process to identify what is possibly a duplicate. So sometimes it can find duplicates that EndNote and Covidence don't pick up, but it is a much more manual process where you have to actually make some decisions as part of what's being done, compared to EndNote and Covidence that is much simpler. So on the screen, you can see a very quick example of the SRA deduplicator. And so this is one of the tools that's more manual. So you can see there's the two records that are identified, and you get to select which that you want to keep, or whether you want to nominate them as definitely being a duplicate or not. There's two modes that you can use in the SRA duplicator. So one is a focus mode, and that involves quite manual checking. The other mode that you can actually turn on for the SRA deduplicator is a more relaxed mode. I guess this is good because it doesn't involve any manually checking, it doesn't involve any human intervention, but you may miss a small number of duplicates as is flagged just on that quick window that's popped up. So next, into tools to support record management. So I'm not going to go into all the different tools for record management. I think the most important thing to point out here is there are lots of tools out there, and I think it's looking for the tool that suits you best. Some of them will actually generate study flow or Prisma diagrams for you automatically, which is an excellent feature. And for anyone that's been in the weeds with a systematic review towards the end and finalizing your Prisma and trying to go back through your records to figure out exactly where your Prisma sits, having a tool that actually does this for you, looking at it, keeping records for how the citations were found, where they came from, the record screen, whether included and excluded, is an excellent tool because it can really be quite a time-consuming process. So I think our recommendation is, if you're using record management tools, try and select one that's got Prisma automatically built in. All right, so the next section is around title and abstract screening, and there is a range of automated and machine-assisted tools available for title and abstract screening, predominantly of randomized controlled trials. So most of what you can see on the screen uses machine learning algorithms to decide whether a study that has come up in your search is likely to be a randomized controlled trial or not. So you can see there the screen for me, system, Covidence RCT, classifier, epi-reviewer, and the RCT tagger are all examples of those. You can see there that some of them are only available for some types of reviews or only free for some types of people, but most of them have actually been very well evaluated. So some of these tools as well have other machine learning aspects been embedded within them as well. And what that does is, what some of those tools do is order the presentation of the citations that you are to screen using machine learning algorithms based on the decisions of previous citations. So it prioritizes those studies that the machine thinks is going to be most likely to be included. And that's embedded within some of the systems there, such as Covidence and also Swift Active Streamer and also Abstractor. So on the next couple of slides, I'm just going to briefly show you two examples of how we've used these tools within reviews. So we'll look at Screen for Me, which, as you can see on the screen, unfortunately is unavailable for Cochrane reviews, and the RCT classifier, which has recently been embedded within Covidence and is available to all reviews. So what is Screen for Me? So Screen for Me is a service that's available for Cochrane reviews of randomized controlled trials, which has three components which it uses to decide whether studies are a randomized controlled trial or not. So the first one is known assessments, the second is the RCT classifier, and the third is Cochrane crowd. So known assessments are defined records that have been through some of Cochrane's citizen science platforms like Cochrane Crowd, which I'll describe in a bit more detail in a second, and has already received a classification or a tag to say that it is definitely describing a randomized controlled trial or not. The classifier is a machine routine that assigns a likelihood score based on whether the machine thinks a record is describing an RCT or not, which I'll go into a bit more detail in a moment. And then the third aspect of Screen for Me is Cochrane Crowd. And this is Cochrane's crowdsourcing platform where contributors from across the world can log on and help to identify randomized controlled trials and other types of health related research. There's a big training package that sits behind that system, and essentially anybody in the world, once they've gone through the training and has kind of checked off the criteria, can actually participate in that citizen science system. So the Screen for Me actually puts your records through all of these three machine learning components. There's no maximum limit on the number of records that you can send to this system, but there is a minimum. So they require you to have a search of at least 500 records before it can be sent. And each of these components has actually been individually and well evaluated. So just as an example of what that looks like, so on the screen you can see the results that we sent recently for our school's implementation review through the Screen for Me system. So at the top you can see there was 4,800 records that our database and other searchers identified. We put it through the known assessments, and so 37 of them were rejected, 593 were identified as possibly randomized controlled trials. We then put it through the RCT classifier where those that were not us randomized controlled trials were rejected, and then we put them through Cochrane Crowd, so any others that were remaining to see if there were other RCTs in that mix that we should have been screening. So you can see at the bottom of those 4,800 records, we only ended up having to screen 1,200, so about a 75% reduction in the amount of title and abstracts that we needed to screen for this review. So it's a massive reduction, an amazing system. So as I mentioned on the previous slide, there's lots of other RCT classifier type tools, but Covenants really is such a great option as it is free to many. So University of Newcastle staff and students, Cochrane reviewers, etc., and lots of other organisations have corporate membership to or subscriptions to Covenants. And the RCT classifying in Covenants as well is entirely automated. So it's the same tool that's embedded within the Screen for Me tool that I just mentioned, which you can turn on in Covenants. Covenants then automatically assesses each title and abstract to determine whether it is a possible RCT or not. You can choose to just tag them, or you can actually ask Covenants to automatically exclude them. So it only leaves the possible randomized control trials in your files to screen. And so you can see on the screen, it's probably a little bit, it's very small, but it's very simple to use. It's literally going into the back end of Covenants on the left-hand side where you can select to either tag the references reporting RCT so that you can manually have a look at them, or you can tag the second one, which is a new release, to remove references reporting randomized control trials before you start screening. If you select that bottom option, you can see on the right up in the import references section, it will let you know how many of those records were automatically marked as ineligible. Okay, on to full text screening. So other time-consuming steps can be finding the full text of your records. Once you've already passed them through title and abstract screening, you think they're likely eligible, but you need to get the full text in. And there's a number of fully automated tools that can support you with this. So both EndNote and Covenants that you can see in the table have this function. And on the screen, you can also see some of the testing that we've done between the two to see how many of the PDFs they automatically find. So you can see that EndNote finds more PDFs automatically than Covenants. Both of these are really simple to turn on within the tools. Within EndNote, you just have to select the find full text and it'll just do it automatically. Within Covenants, it actually just does it automatically for you as soon as studies are included, and you can also do some bulk upload of PDFs from EndNote or from other kind of files as well to get them in ready for screening. So there's currently no fully automated tools available for full text screening. However, tools that you can use that will assist in comparing the assessments between your reviewers and also helping with the consolidation of the full text screening assessments between the review authors, and that's just listed in the table. So you can see Covenants is a good option which compares EpiReviewer is as well, Nested Knowledge and Distiller, Covenants being the only one that is, likely free to most people. Okay, extracting the data. So I think there's not really many tools, if any tools, that have been very well evaluated for fully automated data extraction from PDFs. But there's a couple that I wanted to highlight. So the first one you can see listed there is EXACT, which stands for the Extracting Accurate Efficacy and Safety Information from clinicaltrials.gov. And it's an automatic data extraction tool to help medical researchers extract information from about clinical trials and journal publications. I think, whilst it's free and it's been evaluated, the one limitation it has is that it will only extract limited information. So it extracts information on eligibility criteria, sample size, and primary outcomes, and only for randomized controlled trials. So it's not really suitable for, data extraction ready for, conduct of analysis, or even for putting together your characteristics of included studies table, because it's too brief. Elicit is a newer tool which has been described by some as the chat GPT for research, but it's yet to be well evaluated, and we'll just have a look at this in the next slide. Otherwise, the rest of the tools that are on the screen there can be described as, I guess, machine assisted, and they provide some kind of mechanism for authors to enter information into online data extraction forms, and then some, like Confidence, can compare the data extracted between and identify discrepancies as well. So just a bit of a closer look at Elicit. So as I said, Elicit is a new tool that hasn't been evaluated yet, but it's an automated tool that can search, screen, and extract data from papers, from PDFs, related to an entered research question. So what it does is it uses an AI-powered search engine of 115 million papers from Semantic Scholar. Then it uses natural language processing to identify studies, identifies PDF links through Unpaywall, which is an open access database of articles, and it uses learned language models to then extract the data for each of the categories that you select. So you can use it for searching papers, or you can actually upload your own PDFs, and then you ask Elicit to select which information you want to extract, and it will then provide you with a table of extracted data. And so you can see on the it's kind of very small, obviously, but you can see an example of what it actually can extract in the bottom of the slide. There are some, obviously, limitations to this tool, given that it hasn't been evaluated, it's not free. And it actually can't extract from tables or figures yet, but I think in terms of data extraction, this is a really exciting development, and I'm looking forward to seeing some evaluations come out of this tool. So next, risk of bias assessment. So there's really only one risk of bias assessment machine learning tool or system that's available that's looked to do some kind of semi-automation of risk of bias assessments. It is a free tool, which is great, and it's recommended more as an assistant to human reviewers who can then validate the machine learning suggestions and then correct them as needed. So in terms of how you use it, you upload your PDFs of your included studies into the system. It will extract some trial summary data, which is quite limited, and then it'll generate some judgments and some support for each of your risk of bias domains. And you can see on the right a screenshot for what it actually produces. So you can see the image at the top, and you can see the trial summaries underneath, and actually I should have shown the other. There's another picture as well, which actually shows you some of the judgments and the risk of bias assessments. I think the limitation at the moment with this tool is that it is less accurate than humans, but really it's similar enough. It's a less than 10% difference between human and machine for risk of bias assessments. So still recommended for use or warranted for use. And it can only at the moment be used for risk of bias 1. So it can't be used for the newer risk of bias 2 tool. So the next section focuses on tools for broadly and for data visualization. So there's 3 machine-assisted tools that I'd like to highlight in this section. Web and Epi Reviewer for analysis following the entry of data of outcome data into the system, and all three can be used for different types of data visualization following manual entry of your outcome data. So I'll briefly describe RevMan Web I should say, in the next slide, and also the Epi Mapper, which is an add-on to Epi Reviewer. And at the moment, all three of these are available for Cochrane reviews, or only free for Cochrane reviews, I should say. So RevMan Web, what does it do? So it's a web-based software for meta-analysis, for generates for information on risk of bias and generating risk of bias visualizations, and also summary of findings tables. In terms of how you use it, you can enter data manually for single studies, or you can actually do a bulk import of outcome data into RevMan Web from data extraction files, which you can set up to match exactly what you need to integrate with RevMan Web. It does meta-analysis of various outcomes and types, so whether it's dichotomous outcome, continuous outcome, or with variance method. It also is really simple for doing subgroup analysis and sensitivity analysis, whether that's to investigate your heterogeneity or other aspects that you think might be important within your review, or some of the decisions that you've made in your review, and is literally like a click boxes to generate some of those. It uses all the original data that you've entered, and then it very simply and very quickly and automatically generates your forest plots, your view, risk and risk of bias evaluation. So there's some, lots of information that you can see on the right-hand side about its features, but they're really the main ones that are good to flag here. So the other tool, which is I think a really interesting and really exciting tool to use within systematic reviews, is the Epi Mapper tool, which is for visualizing maps of research evidence. I think what's really exciting about this tool is that, obviously the automation aspect of it, that, you've got your study data already in the tool, and then you click a button and this is what you can see. But it shows in the image on the left-hand side both the number of studies that assess particular outcomes in reviews, but also the certainty of the evidence for each outcome based on your grade assessment. So on the certainty that you've got for each of the outcomes. And it's just an excellent evidence mapping kind of tool for what's included in your review. And you can see these a lot now in published reviews, as well as a way to kind of synthesize and simply describe the results of your review. So you can use this tool as an add-on within Epi Reviewer, and then you can also use the review data using the review data that you've already entered, or you can also use it as a standalone tool. And there's an easy wizard available on the website for how to use it. So I think at this point you're probably thinking that's a whole heap of tools across many stages. Some of them there's consistency across, some of them there's not. So, which is great. I think there's lots of things out there that people can use, and it's great that there's so many things that can reduce our author kind of commitment and resource required to do the review. But how do we put them all together? So on the screen you can see now is just a quick table. This is not exhaustive. It's not every tool, as I mentioned before. These are kind of just the main ones and most accessible ones of automated or semi-automated tools that can cover multiple stages of a review. So what you might like to do is consider some of these as a base, and then look at other tools for what you can embed. On the far right hand side you can see as well the cost, whether it's free, what type of reviews it's free for, whether there's a subscription. And the subscription fees, I guess, across all of these tools range. There's individual fees, sometimes subscriptions, there's student, there's organization, and a lot of them will actually ask you to contact them directly to come up with a price that's suitable, especially when you're talking about organizational subscriptions. But you can see there's quite a few there that kind of mark off like most steps or all steps of a review. So things like Distiller will cover all aspects. nested knowledge are probably some of the bigger ones, but really that depends on like what money you've got available to spend on some of these tools, whether some of these aspects that they do are important to you. So setting up a review protocol or refining your search might not be something that you individually are going to tackle as part of the review. You might have other kind of systems in place that can do that, and there might be other kind of free tools that you might like to start with, and then do add-ons across some of the other tools. So I'm getting close to the end, but you might be wondering at this point, is it possible to fully automate a systematic review without any human effort? So I think the consensus broadly is, and the short answer is no, not yet. But it might not actually be that far away. So there are so many new tools that are being developed internationally that are using AI and machine learning. And their intent is that these additional tools that are being developed are embedded within existing review systems to improve the automation and efficiency. So a lot of these are, prototype versions at the moment, or they're sitting within research groups while they're being developed. But what I'd love to flag is the image that you can see on the right hand. This is a from available, very amazing James Human Behaviour Change Project in Oxford University has developed at UCL. So what system is intended to do is make sure that all of the work that's actually being carried out as part of the evidence synthesis is carried out by automation tools and technologies. So what it does is it takes studies from OpenAlex, which is an open source database, and it uses AI to classify studies. So the AI has gone through machine learning, which can be a particularly manual step, but once it's set up, theoretically it can run automatically. So this tool at the moment is not available for current use, and it's still going through testing, but everything I've heard about this tool so far, it's very, very, very exciting development. It looks like it might be the closest, at least to date, for a system to be fully automated without any. You also might be wondering, how quickly can a review actually be produced, given all of these wonderful new automation and tech-enabled tools? And the answer is, at least so far, 2 weeks. So the very experienced team of systematic reviewers led by Paul Glacio at Bond University, and that's Bond University and Paul that developed all the SRA accelerator tools, had a team which included research clinicians, information specialists, and an epidemiologist. They used their entire suite of the SRA automation tools that I mentioned earlier in the presentation. They used an RCT classifier, they used EndNote to do the screening, and they used Robot Reviewer to highlight some of the phrases important for risk of bias assessments, and they used RevMen to write up the review itself. And all reviewers during this phase all of their time for the duration of the project. So they had 5 very experienced systematic review people using all these wonderful automation tools, and they estimate 61 person hours that were used over a 9-day period, or 9 workday period, to complete the review. And so this was conducted in 2019, and that was before some of these other new tools have actually been introduced. So I think there's definitely potential using this same kind of model with some of the newer tools for it to be conducted much more quickly. Okay, so what are my take-home messages? Nothing groundbreaking here, but there are many tools available for each stage of the review production that can reduce author resource and the time taken to conduct systematic reviews. The majority of these tools that are fully automated, at least so far, are focused on screening the title and abstracts of randomized controlled trials. And I guess across, as I've highlighted throughout, there's limited evaluation of some tools to date, and obviously I've not included an exhaustive list of tools in this presentation, and there's many other tools that are sitting in the wings, undergoing evaluations or being developed at the same time. But yeah, there's so much work going on internationally to embed more AI and automation tools into these systems that we already have in place and are already so effective for reducing the workload involved in systematic reviews. So yeah, my final comment here is watch this space. Rapidly emerging, very fast moving place. Look out for systematic reviews and any other information that you can see, which is certainly what I'm doing to keep an eye and keep a handle on what else there is that we can use within our reviews. So on the screen there, you can see the references of a whole heap of recent systematic reviews of tech enablers that we've used to prepare the information for this presentation. There's also some evaluations of the specific tools that are highlighted throughout the presentation at the bottom there as well, and all their DOIs as well if you wanted to take a closer look at those. But yeah, strongly suggest it, especially looking across those systematic reviews. There will be other tools that these reviews have highlighted that we haven't highlighted, but there's so many out there. But thanks very much for attending. In terms of acknowledgements, many thanks to my amazing team who's helped me get all the information ready for this presentation, and in particular, Dr. Kate O'Brien, who yes, is the most amazing human being, but also does such a wonderful job of working with me across all of our systematic reviews and living evidence, and to also Daniel and Ashley for their assistance. And I think I'm pretty much right on time. So we can open up to questions. Shall I stop sharing?
Yeah, that would be great, Beck. Thanks so much. I have this wonderful kind of image of the Bond team all somewhere really cool in some kind of systematic review retreat, all doing their bits at the same time. And I think, what a way to do it. Jason, over to you for a question. Thank you.
Okay, firstly, that was absolutely fantastic, Rebecca. Thank you so much. And almost everything there was new to me. I hadn't even sort of started into this place yet, but I'm working for the New South Wales Ministry of Health. So we're in a slightly different situation to universities where we don't have so many of the programs free and available. So we're actually looking for solutions, not just for systematic review, but to collect publications, to look at citations, all those sort of things. So if you had my problem, if you had a wad of money, $20,000, $30,000, what would you be doing with that? Where would you put that at the moment? Or would you wait? What's the kind of, and I'm not holding you to any of this if it goes wrong, but what would your advice be to somebody coming into this fresh?
Oh, that's a good question. That's a good question. I think the first thing I'd be doing is trying to partner with people that've got some systematic review experience. I think, these tools are only sometimes as good as the knowledge that you can actually have behind the scenes to do them. Like I think
Yeah.
until we're at the point where things are fully automated and you can literally just do a series, answer a series of prompts and then the system goes away and generates it and sends it to you. I think it's about partnering. So, some of the tools that are are great aren't free yet. And so maybe if you've got some money, so things like Epi Reviewer might be a good option. But at the same
Yeah.
time, you still need those experienced people behind the scenes to be able to conduct the steps of the review. So nothing's really at the point that it's fully automated. So I know, we've got some partners and stakeholders at the Ministry of Health, and sometimes what they might actually do is actually contract out some of the evidence synthesis stuff
Yeah.
for have some of that kind of work done, which we've, done for various organisations as well. So, yeah, I feel like I'm not really answering your question properly, but I think it's about partnering and having the expertise or, seeking consultancies
Yeah.
or other kind of people to get involved, because nothing's really at that point that you can just let it
Yeah.
run.
Well, a lot of the people within the ministry have systematic review experience and such as well.
Mm.
I guess the thing is, it's kind of like someone to carry the load, like someone that does maybe 80 to 90% of the work, then allowing you to be smart about what's left over, It's kind of, and then some of these ones you're examining, like the robot one, I think the tricky part is you don't necessarily know which ones to go back to, like it might be sort of
Mm.
90% as accurate, but then you still have to check everything. Like, I mean, some of those seem to have some sort of margins of accuracy, which,
Yes.
the one about the RCTs, for example, but some of the other ones don't. And it's like,
No,
you
that's
still have to
exactly
go
right.
through everything from scratch.
Exactly. And I think you're right. So like in terms of the development of the field, like the citation screening, like the RC tagger and a classifier and other those types of systems really are, the best in terms of reducing the workload for authors, so the amount of time
Yeah.
involved, because you can reduce that screening right away by 75%. And that's a lot of work that you're kind of saving yourself. But you're
Yeah.
right, like when it gets to risk of bias assessments, there's nothing out there that can do it for you. It can only highlight some of that information for you to still actually make decisions within the review team. So I think there's nothing that does everything, but there's bits of things across the steps that you can select and kind of integrate into kind of one model that you can reduce a lot of the steps, but you will still need, you still need expertise and kind of human effort for some of it at this stage.
Thank you so much. Really appreciate it.
No problem.
Thanks, Beck. We might jump to the chat. Ben has a question. Thanks, Ben. Asking whether any of the search strategy tools are particularly useful in implementation science reviews to differentiate between the studies that are focused on implementation science versus those that are using the term implementation in a more general sense, such as implemented in 12 sites. You're next, Tara.
That's an excellent question, Ben, and I don't think we've actually explicitly tested that. The schools implementation review that I actually mentioned is one that we do want to test that with. I think, it still works for, like, the RCT classifiers still work exactly the same way, so that's not the issue, but I think the question's more around, like, how do you determine the difference between an implementation trial, so a hybrid trial or whatever it is, versus a trial that just assesses some implementation outcomes as part of a process measurement. So that was like explicitly one of the criteria for our schools implementation review, and we didn't find anything that we could use for that at this point. I think what others, and we have talked to some amazing experts in the field, and one of the opportunities might be to develop a bespoke machine classifier where you actually train a machine based on the language that's used within an implementation randomized controlled trial, like using a hybrid design, for example, and you can use that to help make some decisions around the eligibility for the rest of the studies, but it's not something that we've personally invested in, and we haven't got a solution in as part of the tools that I've put up so far as yet.
Thanks, Beck. Tara.
Hello, that was amazing. You've blown my mind again. I always feel like I know some things and then I come along and go, no, I didn't know any of that. So that was really fantastic. My question actually just follows on a bit from Jason's, I guess, which is we have experienced people that know how to do systematic reviews, but the part of the review we often outsource is the search strategy, the keywords, those kinds of things. And so, yeah, I agree with you, Meg, like the Bond University tools look amazing, but because we usually outsource that, it's quite a technical thing to do to capture the right keywords and then across the right databases and that. So I'm just wondering, like the systems like Polyglot and that, are they how easy are they for someone to use that's not a specialist, I guess?
Yeah, good question. I think it's the is it the Polyglot where it's kind of changing the search strategy across the
all the
databases,
visually finishing all the different
so from Medline into
yes.
I don't know, Eric or Sonal or whatever else. So I think from what we understand is definitely very good for that. I think some of its limitations are that it cannot map the subject terms across the different databases. So whilst it can change, so put the and yours and the boolean and all that sort of stuff in the right spot, it can't do some of that kind of subject mapping. So there's still a manual kind of effort involved. And so I think our information specialists and our research librarians that we collaborate with as part of all these reviews are still very, very necessary, and we need their support to do that aspect. So while Polyglot can kind of help to some degree, it definitely can't replace our amazing information specialists and research.
Okay, yeah, excellent. No, that's good. Just I shouldn't have a go at it then. I should get some help from Debbie. Thanks, Meg. Cheers.
I think there was one other question in the chat from Eileen. So just asking whether any of the tools include library subscription access to full text papers.
Ooh, that's a good question. So, well, I'm thinking very much from personal experience here. So I know within EndNote, if we, authenticate and log into the University of Newcastle, we get access to the free PDFs that would then be imported directly into EndNote. I'm not aware of that within Covidence. I think it only accesses anything that is open access. That sounds weird, but it can only access things that are already available online. I don't think there's any kind of library memberships built into the back of it that I know of.
Just one more question here from Nayera. So asking, with so many options, how would you decide which tools you should prioritize for specific reviews?
Good question. Well, I think the first thing I would say is if you are doing a review of randomized control trials, I highly recommend using Covenants as your main system. It will use the RCT classifier to, knock out, many of your studies right from the outset. It's a good base tool. It might not be as good as some other tools for deduplication or some of the other kind of aspects, but it's a good base tool. And I think it's about looking across the suite to see what other things, or the other types of tools across the other stages of the review that you can use at the same time. So I think it just depends on what resources you've got available as well. Like if you've got corporate memberships and organizational memberships or subscriptions available to some of these tools, it might be a really easy decision to look across those steps and go, okay, well, I want this one base tool, and then I'm going to pull something from the search strategy to refine it. I'm going to do, these aspects. So I think it depends on money. It depends on what type of review you're doing. But yeah, definitely I would select a base tool and then look to see what other things you can integrate within your workflow to further kind of reduce the resources and time required to do the review.
Thanks, Beck. And thanks, everybody. Looks like that's all the questions. Sounds like we need to maybe run this again in a year and see where everything's at.
For sure.
Many developments that look like they're close to hand. So thanks again, Beck. And yes, just to confirm that we will share the recording of the presentation and the slides with all the kind of registered participants. We'll pop them up on our website. The recording will be available as well. So we'll also be sending around links to that. Before we head off, I did just want to plug our next webinar. So taking a slightly different tack from this series focused on systematic reviews. So I think coming up on the 4th of June, we have a webinar that will be presented by Assistant Professor Gabriella McLaughlin, who'll be talking through her work around health equity in program implementation. So that'll be really interesting. So yes, thanks everybody. We really appreciate your participation. And thanks so much to Beck and her team for presenting such a really informative and engaging presentation today.